You have started turning the television louder than you used to. Perhaps your spouse has mentioned it, gently at first, then with a trace of frustration, you have started asking people to repeat themselves, and then, when they repeat it and you still do not catch it, you simply nod and smile and pretend that you understood. And somewhere quietly, without announcing it to anyone, you have begun to step back from the conversations that once brought you the most joy. The dinner table where everyone talks at once. The telephone call with a grandchild whose small voice is hard to follow. The gathering of old friends where the room is full of noise. You may have decided that this is simply what age does, that nothing can be done, that this is the slow fading you were always warned about. Tonight I want to tell you, with great care and complete seriousness, that for a very large number of people over the age of 60, this belief is not true, and the act of waiting, the quiet decision to do nothing, is often the most dangerous choice of all. I am Dr. Hiroshi Nakamura, and across more than 20 years caring for older adults, I have watched hearing loss take something far larger than sound. I have watched it take confidence. I have watched it take marriages and friendships, slowly, one missed conversation at a time. And in some of my patients, I have watched it appear to take the very sharpness of their minds. But I have also watched the right intervention bring a great deal of it back. The tragedy I see in my practice is rarely the hearing loss itself. The tragedy is how many years a person waits before they are willing to face it. What most people do not realize is that hearing is not only the work of the ears. The ears collect sound, yes, but it is the brain that turns that sound into meaning. And here is the part that almost no one explains in an ordinary appointment. When sound stops reaching the brain clearly, the regions of the brain that once worked to process that sound begin to grow quiet. They receive less, so they do less. Researchers studying older adults have observed a strong link between untreated hearing loss and a faster rate of cognitive decline. The brain behaves in some ways like a muscle. The parts that are used remain strong. The parts that fall idle grow weaker over time. So when you delay treating your hearing, you are not only missing the words at the dinner table, you may be allowing a region of your own mind to fall silent. I want to walk you slowly through 3 approaches that genuinely help so that you understand what is truly possible and so that you understand why the choice you make today carries more weight than the choice you make 5 years from now. Let me begin with the simplest of all and also the most overlooked. It is the removal of earwax, what we in medicine call cerumen. You may think of earwax as nothing more than a small nuisance, something faintly embarrassing, certainly nothing that could matter to your hearing in a serious way, but this is one of the most common mistakes I encounter. In many older adults, earwax does not stay soft. It hardens and it packs itself tightly against the eardrum, forming a dense plug that fills the ear canal completely. I want you to imagine trying to follow a conversation while standing on the other side of a thick stone wall. The voices are there. The words are being spoken, but almost nothing reaches you. That is precisely what a fully blocked ear canal does to your hearing. I have patients arrive at my office utterly convinced that they needed expensive devices, that their hearing was gone for good, when in truth, a careful and professional cleaning restored a great deal of what they had lost, sometimes within only a few minutes. The relief on their faces in that moment is something I do not forget. But I must say one word with great firmness. Professional. Please do not attempt to dig the wax out yourself. Please do not push cotton swabs or any other object into your ear canal, because this almost always presses the wax deeper, packing it harder against the eardrum, and it carries a real risk of damaging the delicate structures inside. The eardrum is a thin and fragile membrane, and it does not forgive rough treatment. Stay with me here, because this small and unglamorous step is exactly where I always begin with a new patient. Before we speak of anything more complicated, we make certain the path is not simply blocked. The second approach is the hearing aid, and I must speak very honestly about why so many people resist it for so long. Most of my patients do not refuse a hearing aid because of cost, and they do not refuse it because of discomfort. They refuse it because of what they believe it announces to the world. They feel that to wear a hearing aid is to hang a sign around their neck that says they have grown old, that they are diminished, that they are no longer the capable person they once were. So they wait. They wait 3 years. They wait 5 years. I have known patients who waited more than 10, and here is the hidden cost of all that waiting, the cost that no one warned them about. When the brain goes for many years without receiving clear sound, it slowly begins to forget how to interpret speech. The ability to separate words from background noise, to follow a sentence to its end, to recognize the rhythm of ordinary conversation, all of this is a skill the brain maintains through constant practice. Take that practice away for long enough, and the skill begins to fade. So when these patients finally accept a hearing aid, something disappointing happens. The sound returns immediately, loud and clear, but the understanding lags far behind. They can hear that someone is speaking, yet the words arrive as a kind of blur, because the brain has fallen out of practice and must now slowly relearn what it once did effortlessly. This is why I plead with people not to wait. The earlier you begin, the more your brain retains its ability to make sense of what it hears, and the easier the entire adjustment becomes. I also want to correct an old image that lives in many minds. The hearing aids you may remember from decades ago, the bulky, whistling, uncomfortable things your parents may have worn, are not what exists today. Modern devices are remarkably small, often nearly invisible, and they are far more intelligent. Many of them can quiet the noise of a crowded room while lifting the voice of the person sitting across from you. This next part is important, so I want you to hear it plainly. A hearing aid does not make you old. Withdrawing in silence from the people who love you, slowly disappearing from the conversations that once defined your days, that is what truly ages a person. The device is not the marker of decline, the isolation is. The third approach is surgical, and it applies to a more specific cause. Inside your middle ear sit three of the smallest bones in the entire human body. They form a tiny chain, and their job is to carry the vibration of sound from the eardrum deeper into the ear, where it can finally be sent to the brain. In some people, and this tends to run in families, one of these little bones gradually stiffens and becomes fixed in place so that it can no longer vibrate freely. The condition is called otosclerosis. When this bone stops moving, the sound vibrations cannot complete their journey and hearing fades, even though the ear is otherwise healthy. There is a procedure for this called a staptectomy. In it, a skilled surgeon removes the stiffened bone and replaces it with a tiny prosthesis, a minute artificial part that restores the chain of movement and allows sound to travel inward once again. For the right patient, with the right cause, the improvement can be genuinely remarkable. I do not describe this to send you rushing towards surgery, and I want to be clear that it is suitable only for certain people with this particular condition. I describe it so that you understand the deeper truth. The cause of hearing loss matters enormously. Two people may sit before me describing the exact same difficulty, and the reason behind it, and therefore the answer to it, may be completely different. One needs only a cleaning, one needs a device, one may benefit from surgery. This is precisely why the worst possible response is to assume that nothing can be done. The only way to learn which path belongs to you is to be properly and thoroughly examined. I want to tell you about a patient because his story holds everything I am trying to say. His name was Walter, 74 years old, a retired schoolteacher. He was a thoughtful and proud man who had spent his entire working life standing at the front of a classroom, being listened to by others. When he finally came to my office, it was not by his own choice. His daughter had brought him with a worried look that I have seen many times before. She told me that her father had stopped attending his weekly card game, the one he had played with the same group of men for nearly 30 years. She told me he had stopped answering the telephone, letting it ring until it went silent. The family had begun to believe that he was growing distant, perhaps even confused, and a quiet fear had entered their conversations, the fear that this might be the beginning of dementia. They had nearly convinced themselves that they were losing him. But when I examined Walter carefully, I found something altogether different. One of his ears was almost entirely blocked with hardened wax, packed so tightly that very little sound could pass through it at all. The other ear had a moderate loss of the kind that a hearing aid could address well. Walter had not become confused. His mind was clear and present. He had simply stopped hearing the world around him, and a man who cannot hear a conversation will over time stop trying to take part in it. He had not withdrawn out of confusion. He had withdrawn out of exhaustion and quiet embarrassment. We cleaned the blocked ear that very same day, and over the following weeks, we fitted him with a device for the other. The change, when it came, was not only in his ears. Within 2 months, his daughter telephoned me, and I could hear the emotion in her voice. Her father had returned to his card game. He was telephoning his grandchildren again, asking about their lives, laughing at their stories. The man they had feared they were losing had come back to them. He had never truly been leaving, he had only been unheard. If you recognize yourself in Walter, or if you recognize someone you love in his story, I would like you to write the single word listening in the comments below. It helps me understand how many of you are quietly carrying this burden, often in silence, and your comment may give courage to another person who reads it and realizes that they are not alone. So what should you actually do calmly and without fear? I do not want to overwhelm you, so let us reduce this to one clear first step. Make an appointment to have your ears examined by a hearing professional, an audiologist, or a physician trained specifically in this area. That single act will tell you more than years of worrying ever could. And when you are there, I want you to ask two simple questions. The first is this: is any part of my hearing loss caused by something that can be removed, such as wax? The second is this: if I do need a hearing aid, what is the true cost of continuing to wait? That second question matters far more than most people ever realize, because the answer is not measured only in money. It is measured in the brain's ability to keep its skills and in the relationships that fade a little more with every year of silence. I want to leave you with reassurance because fear has never healed anyone. The human body, even well into later life, holds a remarkable ability to respond when it is given the right conditions. The brain that has grown quiet from years of missing sound can very often reawaken when clear sound is returned to it. The hearing that felt permanently lost is for a great many people simply waiting to be reached again. You are not powerless in this. You are not destined to fade slowly into silence and watch the world drift away from you. But I will be honest with you, as a doctor who has watched this unfold many times, the door does not remain open forever. The longer it is left closed, the harder it becomes to open. And that, more than anything else, is the reason I ask you, gently but firmly, not to wait. If this was helpful to you, please subscribe to this channel and give this video a like, so that other people who need this same guidance are able to find it. I will keep sharing what I have seen in my own patients, calmly and honestly, so that you can make wiser decisions earlier, while the choices are still fully in your hands. And tell me in the comments, how long did you wait, or how long have you been waiting, before deciding to take your hearing seriously? I read what you write, and your honesty may be the very thing that helps someone else act sooner than they otherwise would have.